The broadcast is now starting. All attendees are in listen-only mode.
Yes, good day. My name is Dan Davidson, and I work with the Illinois Soybean Association. And I want to welcome you to today's webinar that's sponsored by the Illinois Soybean Association as well as the ILSO Advisor Soybean Management website. Our webinar today is being presented by Stephanie Porter. The title is Scouting and Managing for Soybean Diseases in Mid and Late Summer. And we're just entering into that midsummer phase right now as we just ended July. Stephanie is one of our soy envoys, and you can see her blogs on the ILSO Advisor. She's an agronomist for burrs, seeds, and you can see her blogs on her website. As an agronomist, she supports customers and does education on corn, soybeans, and alfalfa. And when we start off, Stephanie can say a little bit more about herself. Just a few things about today's program. We kick off promptly at 10 a.m. Central Time. We want to be done at 11 a.m. We'll spend about the first 45 minutes or so, 45, 50 minutes in the presentation. And at the end of the event, we'll answer some questions. So feel free to post some questions. When you see your little dashboard over on the right side of your screen, go ahead and send some questions in, and we'll answer the questions at the end of the session. If you registered for this event for the live presentation, you would have submitted your CCA number, and your name and number will be submitted to the CCA board. And this event hasn't been approved for 1CU and pest management. Your number will be submitted, and you can track that if you log online to your account at the CCA site. This webinar is being recorded, and it will be posted online on the ILSO Advisor, and you can come back and listen to it anytime. If you're listening to the recorded version and you want to get your single CEU in pest management, you just go online and you self-apply for a single credit for participating in this webinar. But if you're in the webinar today, the live session, and you want to gain that CEU, you need to stay online for the event, because they'll look at that at the end of the session. The people that stayed online, their number will be submitted for credit. Again, thank you on behalf of the Illinois Soybean Association and the ILSO Advisor website for coming online and listening to our webinar today. And Stephanie, I'm going to turn it over to you.
Well, good morning. Today we're going to talk about one of my favorite subjects, diseases. I do have a background in plant pathology, and I previously was the diagnostician at the U of I Plant Clinic. So today we're going to talk about some of the most prevalent diseases that I have run into either in my travels. I cover from southern Wisconsin all the way down to southern Illinois. Mostly concentrating on the eastern side of the state, but we are out of Orangeville, so I also spend time there at our production facility as well and help out with research and evaluation of soybeans. So today I hope to talk about most of the prevalent diseases. I know there's not enough time to cover every single disease out there, so some of the ones that I feel that are more important we'll spend a little bit more time on. I also want to talk about, of course, infection and scouting a little bit and concentrate on some diagnostics and, of course, management. I want to concentrate on certain growth stages, of course, when infection occurs. So there's going to be a lot of diseases today where infection occurs early, but we may not see the actual symptoms till later. And so I think that's very important to talk about. And most importantly, I wouldn't be doing my job if I didn't take a moment to talk about the disease triangle. So when we're talking about each one of these diseases, we're going to talk about host, pathogen, and environment. And some of these will take a little bit more time to focus on environment, like with sudden death syndrome will be one of my examples that I use of how huge it is and why might we be seeing these diseases more often. And of course hosts, and I think that working for a seed company and working with a breeding consultant, we've really learned that breeding resistance genes tolerance is huge on whether or not we're seeing diseases or not within the state. And so we may focus on that with brown stem rot as an example. So we're going to go ahead and start out. I kind of mentioned soybean varieties. So when we evaluate for soybean varieties, different companies may evaluate differently. There's going to be different breeding programs out there. Today I'm going to talk about many soybean varieties, as you probably know, do have disease ratings. I do want to take a minute that, we're going to be concentrating on diseases today, and they're huge in the yield of soybeans, but there's other things that we also have to consider. And so we have to not get too caught up on diseases, but we have to hopefully have the right genetics, the right marker technology, the right genes, if we can. Also concentrating whether or not that variety fits in a certain environment, a certain soil type, and herbicide sensitivity is becoming huge as well. And so when I evaluate soybeans, I not only want to make sure that they have the best disease tolerance or resistance, I also want to make sure that they do well in a certain environment in order to give our customers the best yield. So I use this slide to demonstrate that different companies may be evaluating soybeans differently. There may be different breeding programs out there that concentrate on different things. My company deals with different suppliers. So I know that one supplier, for example, in 1 year, if we don't see sudden death syndrome, one company may be evaluating certain varieties in a greenhouse to see whether or not they're seeing symptoms. With sudden death syndrome, we're only evaluating symptoms. There's new research out there that are trying to locate certain genes that have resistance, but we just haven't got there with some diseases like, sudden death syndrome, white mold. But there's other diseases like brown stem rot where we have good marker technology, where we've actually identified several genes and we can select certain materials that have good resistance. We'll also talk today about certain varieties that have certain just genes, single genes, where we can get some resistance. And so I just wanted to talk a little bit about that first as the host part of the disease triangle before we kind of went into the actual disease talk. So I know I'm supposed to be talking about mid-season and late-season diseases, but I cannot start out without talking about a little bit about early season. I do a lot of teaching about seed treatments, and I think that's huge in soybeans. I come from a company where actually most of our seeds are treated thus far. That could change a little bit maybe in the future, but we are 90% treated soybeans, and I think that's huge for us as a company. I also am going around and telling people that research and actual sampling from plant pathologists in the Midwest have shown us that Pythium is huge. It's actually the worst issue that we're running into. In the past, we've talked about Pythium infecting during cool and wet conditions. We've actually learned through this research that it can infect in warm conditions as well. And so I think this is one of the biggest things that we're up against in early season with soybeans, as well as Phytophthora, and we'll talk about that a little bit as well. So when we talk about seed treatment, and of course I really do believe in seed treatment, but the number one thing that we need to realize, if you're seeing a lot of early season root rot, and this could be due to, we have to check out the quality of seed. If people ask us if they want to see cold or warm germ testing, our tests, we will share that information with them. I mean, that's one thing that you would want to test out. When we think of root rot, and there's going to be some diseases we talk about today that affect early in the season. And one of the first things when I think root rot, I think stress. And so we want to make sure that we rule out all the other issues and not just blame root rots as a possibility, because nothing's easy. It seems like in ag, it just seems like one thing leads to another. And so we want to not get caught up in just saying, oh, this has a disease. We want to make sure that we follow all the steps and make sure that we rule out all the other possible management issues that could be going on in a field. And so most of the state I know does do crop rotation, but that is a big thing, and you'll be hearing me saying it over and over and over today as a broken record. But when we're talking about early season soybean disease, that definitely helps out in most cases, but not always. Another thing is that we do have resistance with Phytophthora, and we'll talk about that in a little bit. We do not have any kind of known resistance for Pythium. Yes, different varieties can vary with resistance, I guess, or susceptibility, I should say, to Pythium. But we have resistance thus far for Phytophthora, and so that's why seed treatments can be huge. Most people now are planting earlier than ever, especially in some areas this year, including my own family. And so kind of a game changer when it comes to management of disease. And we will talk about that further in the presentation. Another broken record, of course, is reduced till or no-till fields. Either one can promote or reduce disease, and we'll talk about that. And also, we talked a little bit about seed vigor. That has to do with germination and seed quality, of course. And previous history. I mean, are you keeping track of what kind of issues you've had in the past? The other point I want to make is that as people are companies are spending millions of dollars on seed treatments right now. It's huge in the industry. It's kind of the hot topic. And as there's downstream seed treating, we have to be really careful to find out what seed treatment's not just seed treatment. Does it have an insecticide on it? Does it have fungicides? What fungicides are on there? This is a question that we're going to have to keep asking as we start looking into the future and trying to get a good price on our seed. And it's going to be huge. So in the future, if you look into seed treatments, we may be actually seeing prescriptions where I constantly am getting Pythium in this field. I need to make sure I have a certain seed treatment for Pythium. I'm getting sudden death syndrome. I want the treatment for sudden death syndrome as well. The other thing that a lot of people don't realize is that Phytophthora and Pythium are oomycetes. They are fungal-like. They're not actual fungus. This means you have to have certain active ingredients that actually give you control of those oomycetes. And you need to make sure that they have them. There's been no resistance reported up until now that we are totally aware of in Illinois with certain active ingredients in seed treatments. However, there have been some, for example, reported in Ohio. It's always possible. So there the ethoboxam is actually a different site of action. So this is something good in the future where we can actually start rotating different site of actions so we can avoid resistance for control of some of those oomycetes out there. So this kind of segues us into Phytophthora root rot, and we're going to talk about it today because not only does it infect early in the season, we can also see it later in the season. To be honest, I don't see a lot of it out there, and so I think that our seed treatments and our resistance are working up until this point, but we can actually have issues with it. It has been a huge issue in the past, and as you can see, they estimate 39 million bushels of loss from this disease. And so I think times are changing. It's always something to be aware of and on the lookout, and I think that sometimes other diseases that we'll talk about today are easily confused with Phytophthora root rot. But one thing is for sure, you are going to see these diseases, Phytophthora, Pythium, you have to have water despite the temperature, you have to have water in order for these diseases to infect. And that's how they infect. If they don't have water, they will not infect. And so these are going to be in areas where you have poor drainage. The first question I usually ask, especially in Eastern Illinois, is this field tiled? It's like I'm a broken record. Farmers hear me say it over and over, and usually this year, for some of the root rots that I found, they said, no, I want to get this field tiled, or I just acquired this field, I want it tiled. And so that's something definitely to be on the lookout for. As many of you are aware of, there are different soybean genes in different varieties for Phytophthora in soybeans. One of the most common one, especially in the varieties that I have as a company, of course, this is maybe different in the company that you work for or buy from, but one of the most common genes is the RPS1K. And as you can see, this is a Wisconsin slide that I borrowed, but it's effective, they say, in 99% of the fields. Single gene is used because it's easier to acquire in breeding. And you can see that there are different races of Phytophthora, and that it shows which races that gene is supposed to help hopefully control. And I know, as you're all aware of, that Phytophthora has scores, and so that's definitely something you can be on the lookout. If you've had issues with it before, make sure you have a high disease score. A lot of farmers are not looking at these scores, and so I oftentimes over and over say, have you looked at this certain score? The other thing that when I'm evaluating varieties, and I've actually selected a couple of varieties for our lineup, is not only do they have a gene, but they might also have good Phytophthora tolerance. And so that's something different as well. And so when we have a score for our varieties, it's kind of incorporating not only if it has a gene, but also the tolerance score as well. So that's something to take note of. Now, I said that the RPS1K gene is 99% effective. Well, here's the 1% that was not affected. This was last year in the heavy rain. I've only seen Phytophthora once since working in the last 3 years for Burris. And this was the one time. This is a grower, a dealer of ours. It's a very good scouter, and he actually sent me these pictures. And so I was able to test it. This is probably something that could be showing up now or a little bit later. And I'm able to actually look at roots under the microscope, or there are these little quick strip tests. Now, I don't promote those for use out in the field because we want to make sure that the roots are really cleaned off. Because if you accidentally get some Phytophthora or soil in the test, you could actually throw the test off. And so we want to make sure those roots are very, very clean, and then use that quick strip test. So I say it's kind of like a pregnancy test. So you're going to be either positive or negative. It's kind of a similar kind of thing with GOS as well in corn. Now, the one key feature of Phytophthora, and we're going to point out here in the picture, is it oftentimes has a lesion on the base of the plant. And this is a disease that can easily be confused with a lot of others, and we'll talk about that later. But as you can see, it usually shows up in a patch. It's not going to be scattered, and it's almost, we've seen some lightning strikes too, so it's a little bit more spread out than a circular pattern. And it's going to be a lot easier to diagnose when that stem's still green. So when you see those dead plants, it's going to be really, really hard to diagnose. And the other thing I want to point out is the leaves are still attached. Now, this is another thing that we're going to constantly keep talking about. Phytophthora is not the only disease that the leaves remain attached to the stem. And so it's going to be hard and often confused with a lot of other diseases out there. So now we're going to start talking about some of those diseases that are infected early in the season, and then you see some symptoms later on. So these are going to be sudden death syndrome, brown stem rot, and charcoal rot. Now, I've also included northern stem canker and white mold. So northern stem canker is going to infect not early season, not as a root rot, of course, but it's going to infect earlier in the season, so that's why it's included on this slide. And white mold, of course, infects at flower, and we will talk about that. I also want to take note here where we do have disease ratings for a lot of these diseases. And so this is another thing you can look at. Make sure if you've had the disease in the past and you've for sure identified it, you can always, and I know a lot of people are aware of their variety soybean ratings. Now the issue with stem canker, and we'll talk about it a little more later, is that there are differences in certain varieties depending on the maturity. Some of them may be earlier varieties, if I understand correctly, may not have total resistant ratings, or maybe the company doesn't have ratings on those yet. And so that's something to kind of take note of, and I think there's being a lot more work done, of course, on this disease. The other thing that I want to point out is, and we'll talk about, is a lot of these diseases can be seed-borne. So that means they can move in if you don't have disease-free clean seed, or of course nobody's using bin-run seed, but this is just another kind of warning. This is why we want clean seed, because almost all these diseases can move into a field via seed, and so that's why it's so good to have good seed out there. So some seed treatments are going to help us for some of these diseases, and we'll talk about that, but sometimes seed treatments don't help for certain diseases, of course. So we're going to move in. We talked about Phytophthora. So I think that since I've been at the plant clinic, I think it was around 13, if I remember correctly, I saw stem canker for the first time come into the plant clinic. Now, there wasn't a lot of it that came in, but it really kind of made me start thinking, and I had talked to others, other plant pathologists, and they thought that perhaps this disease was moving in, and that maybe it was because we were questioning resistance in some of the varieties, and that could be a possibility as well. But I also want to take note that in the last few years we've had really cool wet conditions early on, and so we're planting earlier than ever, and we're having the right environment for it as well. And I'm going to be honest here and tell you that most of what I've found stem canker was in Wisconsin. I've only been in a few fields, and it wasn't just ours, it's others as well, that I found stem canker in. And I've also found it in northern Illinois in a couple of fields last year. I think it's very easily confused with Phytophthora. So I wanted to circle, you can see the circle here, that a lot of people think that when you see this little hook on the top that it's Phytophthora automatically. And you have to dig up the plant, you have to look at the stem. Stem canker is much easily more identified when it's green. When it's dead, everything's brown, and so it's really, really hard to see that dark lesion or that cankered area at the node. And so that's why we need to be out there scouting and looking earlier so we can find this. So whenever I found my stem canker last year, it was a little bit later in the season, and we'll talk about that in the next slide, but it was also scattered in with white mold. So don't automatically assume that it's all one disease. So you can also find a little bit of white mold and this disease as well about the same time as when I found it. So we pointed out in a previous slide that Phytophthora has that dark lesion at the bottom. This has dark lesions at the node. And so these are some pictures that I've taken out in the field of what it actually looks like. So there is a lot of work being done on this disease. And it's kind of, I know I don't want to leave anybody out, but I know Iowa State's been doing some work, Wisconsin has been doing some work. And so one key thing to point out today is that they are definitely finding out that northern stem canker is part of a disease complex, which is kind of complicated, but I think that more information will come out in the future. But one thing to know is that stem canker is associated with pod and stem blight, which is this pathogen here. So when you hear about phomopsis, it's also associated with that as well. So phomopsis, pod and stem blight, is actually this, as you see here, seen. It shows up, and you can see it later. It causes these bleached out areas on the stem and these pycnidia that are in rows. So not to be confused with charcoal rot. It also causes your Phomopsis seed blight, as you can see here. And so we usually don't see a lot of this until later in the season. But the one key thing that plant pathologists are telling us now is when you see this kind of look inside, it's not charcoal rot. This could be associated with the Diaporthe disease complex, which you're not going to see earlier when it's green. It's going to be more apt to be seen later in the season for diagnosis. Now, there are also two different kinds of stem canker. Both have been reported in Illinois, but the one I want to talk about today and the one that I've found out in the field is northern stem canker. Now, the difference, of course, is they're two different pathogens. As the names imply, most of the time, southern's to the south, north, of course, to the north. But the difference when you're looking at it is that northern stem canker girdles the lower stem, and southern may just be kind of one side of the stem. Now, when I say lower stem, I don't mean like as in Phytophthora. I mean like lower part of the plant. So we have to actually, you know, not just look at the tops of the plants, but we got to dig down and get down to the base to look for some of those cankers near the nodes. When we found this out in the field, it's been in patches, and I've also found it scattered throughout the field. One instance, it was actually where the water ran from a dairy. So I cover southern Wisconsin, so I'm looking at it with the cows practically. But there was some runoff of water, so that's something to be aware of too. That would make conditions more conducive for this disease. But it definitely likes those early conditions of wet weather. I also, and Iowa State has confirmed this, Dr. Mueller says that he usually finds it in areas of higher populations. Well, guess what? I did too. This certain individual, this isn't my picture, but what I found looked almost identical to this, and definitely take some population counts out there, because my certain customer actually had populations of 200,000 plants per acre, and he also had some white mold. So white mold's going to be more prevalent in the same environmental conditions and the same high populations. A lot of misconception is that it'll happen in the lower ground. It actually occurs in some higher ground. And again, you're going to find this later. So the cankers are going to be after flower. Just try to find a little earlier so it's a little bit earlier to diagnose. There are going to be actual differences in varieties. There can be with this disease. So this is one thing I really have my eye out for when I do my evaluations of our different varieties, because we don't have disease ratings per se for this disease necessarily. It's going to be overwinter in residue, and so again, I'm all for no-till, but some tillage might help a little bit if you're having major issues with disease. But I really want to put more focus on environment. I really think that's why we're seeing a little bit more of this disease, and possibly genetics. Fungicides will not help stem canker. However, seed treatment and fungicide will help the Phomopsis portion of the disease, as it is a complex, so it's a little complicated. I also wanted to put up this picture here just to make you aware of that can look like other diseases as well when it first starts coming on. So just be aware of that. So anything that girdles the stem, so everything we're going to talk about here on out almost, that's going to interrupt that water flow, that translocation, you can get the same symptom in these diseases, and so it can be confused with other diseases out there. So this is moving on into brown stem rot. So this slide's actually going to look like a lot like the same talk that I'm going to give for sudden death syndrome. We'll spend a little bit more time, of course, on sudden death syndrome. I'm still seeing some brown stem rot out there. I don't think it's disappeared. It's still lurking. It's still out there. Saw some out in maybe 2 years ago or a year ago. Just isolated events. But I do think, and we'll talk about this more, we're not seeing as much of it because we have some really good resistant varieties out there. This disease survives in residue, and again, it infects the main and lateral roots. And so it'll slowly grow up that plant, and if the conditions are conducive. So you have to have that cooler weather in order early on for it to infect. However, if things start getting hot, which they kind of did this year, maybe too late, this disease will totally stop, and so that's good. But oftentimes, this will usually show around R3 to R5, so definitely after flower, late in the season. And it usually shows up when you start getting high temperatures. So again, it infects early on if it's cool, but it'll stop infection if it gets hot early. But the symptoms, foliar symptoms, will start showing up if it gets really hot out and dry. And so just like sun dust syndrome, soybean cyst nematode can make this disease worse. I didn't spend a lot of time on soybean cyst nematode today. In my view of things, it's a separate pest all in itself. I do not consider it a disease. It is a pest, and you could do a whole presentation just on it in itself. A lot of times, most of our soybean varieties have the PI 788 resistance for soybean cyst nematode, and it has been said that a lot of those varieties are also resistant to brown stem rot. Just like sun dust syndrome and a lot of those other diseases, you get that interveinal chlorosis or this symptom on the leaf. And that's also due to a toxin. It's not the same toxin that sun dust syndrome gives off, but it's a toxin that causes that look to the plant. Now, the leaves die and remained attached to the plant. So this is kind of a broken record. This is the same as Phytophthora, the same as Stem Canker. Brown stem rot also will stay attached to the plant. So this is a little different than sun dust syndrome. So it's said, now this is not 100% of the time either, but most of the time the leaves die and remain attached to the plant. With sun dust syndrome, you're going to get some defoliation, and so that's one of the differences. The other thing that causes issues in diagnosis is that symptoms can vary with different genotypes or strains of brown stem rot. And so if you're seeing leaf symptoms, oftentimes that's said to be genotype A. The vascular staining will also differ with the different genotypes, so that can make it confusing. The other things that symptoms to change, of course, is the environment and different varieties. And so nothing is ever black and white in my world. With the account managers, that drives them crazy sometimes. And so whenever I'm doing some training, so nothing's ever 100%. The other things that I see differently when I'm diagnosing brown stem rot is a lot of times it's a little bit more isolated. Not always, but it just seems a little bit more isolated in patches when compared to sun dust syndrome, which can infect an entire field, unfortunately. So with brown stem rot, it's said that you can get some yield losses of around 17 to 25%. When we talk about sun dust syndrome, I'm going to say, have a slide that I put up that says losses of up to 100%. So it's a little bit different. I do think that we have less yield losses because we have such good resistance. So some of that, of course, yield loss is due to reduced seed number and size. And so the greatest yield loss is going to be due to those leaf symptoms that we see out there. And again, when this disease is the worst is whenever we have the perfect storm. We'll talk about the perfect environmental storm for sun dust syndrome. But when we talk about brown stem rot, the perfect disease storm would be if it's cool and wet early on, and then all of a sudden at pod fill, it's drastically changed and we have hot, dry weather. And that's most often when we see issues with this disease. It's kind of similar, it's kind of like a reduction of roots, almost kind of like soybean cyst nematode. you're going to see most losses from soybean cyst nematode as well in drought years. So when we talk about management, I know I've said it over and over again, but I do believe and I do know that we have good, reliable gene markers for this disease, and so that's kind of a game changer. And so our disease ratings out there are really darn good for this disease. And so the other things that we can do, and we always want to take an integrated approach to all of these diseases, is rotation to a non-host crop. And this is another disease that can survive in residue. And so that's another thing to take note of. Now, there's one difference in this disease, and it's kind of a quirk to it. So a lot of the diseases that we're going to talk about, or we have talked about, have survival structures. So we're going to talk about some of those in a little bit. So white mold, sudden death syndrome, charcoal rot, they all produce these survival structures that can survive in the field for years. And that's what makes it so bad. This disease doesn't have survival structures, but it has this asexual type of reproduction where its inoculum can actually increase throughout the winter. And so that's really, really bad. Bad thing about this disease. The other thing is you have to be really careful about soil pH. It's going to be worse in low soil pHs, and in some instances, and this is also true of sudden death syndrome, and I saw it in 14. So some of these diseases that infect, and you see symptoms that affect yield or grain fill in late season, if you have less time in an earlier maturity, you're going to see less disease. And so I do believe we have infection of sudden death syndrome as you move north in the earlier varieties. I just think there's less time for it to do damage, if that makes sense. So now we're moving on to sudden death syndrome. So I've kind of mentioned that we're going to spend a lot more time on this disease because it's just been huge in the past, and I've talked over and over about it. And I find it very interesting that as I move north into Wisconsin, they want me to tell them about this new disease called SDS. My dad had this when I was little, and so this was one of the first diseases I ever knew. As I mentioned before, it does have survival structures. So it survives in the soils, these tiny, you can't see them, but little survival structures. And it infects the soybeans in the springtime during those early vegetative stages, and it first infects the root cortex, as you can see here, indicated on this slide. This was one of the best things I think I found during 2014 by Angie Peltier of U of I Extension. She put out a blog, and it's just something I've used over and over again. I apologize if you're seeing it for the second time or third time, but I think it's a great way to help illustrate what happened in 14 in her area. This was just at her research station, and what happened was just the perfect storm to start bringing on sudden death syndrome. So what she did was she went out there and planted one soybean variety that had a sudden death syndrome rating of a 7. So the higher the number, so this one was pretty good rated. It also had a good rating on soybean cyst nematode as well. And so what she did was she actually planted at different planting dates, as you can see over in this column. And then she actually took air temperatures and soil temperatures. And so this helps, and this is when she started to see symptoms, of course, of sudden death syndrome. And so what this illustrates is that in 14, this variety was most affected at these planting dates when we had the perfect early season temperatures. So it likes around that 60-degree mark or cooler, and that's kind of the perfect storm for this to keep going. If we have rains and if it remains cool, which it did during that year, that is the perfect storm for sudden death syndrome, and we had some severe to moderate symptoms as well. If we plant later, sometimes the temperatures of the soils are warmer, and so that helps us with some of the symptoms of SDS. So if, again, the symptoms will occur if conditions remain conducive. So that would be you still get some water out there, some moisture, and we have cooler conditions. It will continue, the fungus will continue growing into the vascular tissue. So you can actually have infection but no foliar symptoms. And in 14, kind of that second week of May, there was a big rainstorm, a heavy rainstorm, and that's oftentimes what's needed to move that toxin from sudden death syndrome up into the leaves, and that's what causes the foliar symptoms. Now, sometimes if the soil is moist, you can pull up those roots, and this happened time and time again during 14 when I was pulling up some roots just randomly as I went down the road. You could see this blue fungus. I mean, I wouldn't use it as a diagnostic symptom, but this is definitely something you can see with SDS. And of course, everyone's heard this, you have to split the stem. So this is to tell the difference between brown stem rot, of course, and SDS. So if we split the stem, again, you can get some browning of the internal stem there with brown stem rot. SDS should be, the pith should be white. The other thing that's kind of confusing, though, and I've seen this with brown stem rot, is sometimes, remember I said those symptoms can kind of vary, and so the stem may not be as brown. And so you just want to make sure what kind of disease you're dealing with when you're trying to tell the difference between the two. So the problem with SDS, and I kind of mentioned this before, is you get those reduced leaves start dropping, and that's really going to hurt you during pod fill. And so when you get yield losses with SDS, it's because of reduced seed number and due to flower and pod abortion, so that's really bad. The earlier that you start seeing symptoms, the worse yield loss you're going to get. And so if you see the disease after pod fill, the yield loss is going to be due to reduced seed size, reduced pods, reduced seed weight. The other thing that people don't realize is one thing leads to another. And so you can start getting other issues once that plant's stressed with one disease, then other diseases start showing up. And so your seed quality really starts to be reduced. And again, as I mentioned before, with SDS, you can get yield reductions up to 100% if you have the perfect storm for this disease. So one last review of sudden death syndrome is I do believe it's one of the top diseases. We do have to think about that even in a year where you don't see foliar symptoms, that Fusarium rot could still be occurring on the roots. So that's one thing to consider. It's definitely going to depend on the environment. There is no variety that is immune to this. There are different ratings, but there is no soybean variety that's immune or going to resist sudden death syndrome in the perfect storm. So as we plant earlier and earlier, we are planting into cool, wet soils. And so that's definitely going to be the perfect conditions for sudden death syndrome. You can still see sudden death syndrome in warm soils if you have a lot of moisture. And this was apparent in 14 when some of the double crops even had sudden death syndrome on it. So it's not 100% again, have to be cool, wet early on. Moisture will bring it on as well. Now, SDS and SEN do go hand in hand, but not always. It's not 100%. And again, a lot of times, sudden death syndrome is going to show up in those poor soil-drained fields, those fields that aren't tiled. I've seen that. And it's also going to show up where you've got compaction in the field. So make sure you dig up those roots and make sure that there aren't other issues going on. So this is kind of my example of to try to illustrate some of the perfect environmental conditions for sudden death syndrome. So since we had so much sudden death syndrome in 2014 in Illinois, I got asked the question a lot, especially in central Illinois, why didn't we see SDS in 2015? So I went on the Midwest Regional Climate Center and I tried to look up averages of temperatures. Now this isn't going to be exact, but it just visually helps to teach people or illustrate where we had certain temperatures and where we didn't have certain temperatures. So in 2014, sudden death syndrome started showing up again, kind of May 6th, 7th, 8th, 9th, 10th. That was the date I kept hearing over and over, planting date, that I kept hearing over and over again. And so when we look at those average temperatures during that week, you can see, I know you can't read the legends very well, but lighter is going to be cooler temperatures. So our cooler temperatures were seen kind of, I circled the area. That's kind of where the perfect temperatures were for sudden death syndrome in 14. Now in 2015, if we look up the same average temperatures during the same time frame, you can see that central Illinois and southern Illinois did not have cool temperatures like they did in 14, and so that could have been the difference. Also, I also compared rainfall in both years during those same time frames. Now, of course, sudden death syndrome needs rain throughout the entire season to keep on growing inside the plant. And of course, I do think that drought will hinder it a little bit. But as you can see here, this circle indicates, again, that same circle that I had where the cool temperatures were during this time frame. The heavier rainfall was, of course, the darker areas. And so these are some of the areas where we saw the worst SDS, cool temperatures early on, heavy rainfall, and the starred areas of course, in our forest footprint were where some of the worst sudden death syndrome occurred. And unfortunately, for one of our account managers, it was in his area 2 years in a row. So when we're looking in 2016, I kind of did the same thing, only we had people plant soybeans in central Illinois a lot earlier this year. So when I looked at some of the average temperatures, I took April 1st to May 19th as my dates, and I compared 2016 to 2014. And what kind of scares me a little bit is that we kind of set ourselves up for some early season cool temperatures. As you can see, 2016 almost mirrors exactly 2014 during this time frame. So this definitely could be setting us up for some sudden death syndrome this year, except for, again, I mentioned this, the drought will slow it down. I do believe that. But if we start having cool temperatures like we did just recently, that favors the disease, and of course areas that are getting the rain may need to watch it out. Again, for that same time frame, April 1st to May 19th, 14 compared to 16, I also compared rainfall, and they're also very similar with some differences. Of course, the green being the heavier, and this is of course earlier, so this is going to change, and I haven't done anything recent with this rainfall. Of course, it's going to be totally different now. So the one thing I want to reiterate with sudden death syndrome is there is no in-season rescue treatment. I am very aware that there is a product that I'm not going to mention that has sudden death syndrome, that it's an actual foliar that you can spray on it. According to research by Iowa State, they did not find that this did help with sudden death syndrome, so I do want to mention that. So there is no, to date, in-season rescue treatment for sudden death syndrome or any of these other diseases that I'm going to talk about except for white mold. You can plant later. This is something that my dad did, and he always had one field he knew he got SDS in, so he planted later to try to make sure he planted into some warmer, drier soils. Now we have seed treatments out there for sudden death syndrome or soybean cyst nematode, and so this is becoming a game changer. This is allowing people to have the insurance they need to plant earlier into the season, and so that's changing sudden death syndrome management as we know it. Again, we do want to plant varieties with higher SDS scores or higher SCN scores, but remember, no variety is totally resistant to sudden death syndrome. People really do need, I know people know they have soybean cyst nematode, it's patchy out there, but we do really need to pay attention to our soybean cyst nematode levels as well in certain fields. One of the questions that I get a lot is, will a corn-soybean rotation slow it down? However, it has been proven that sudden death syndrome, the fungus, can survive on corn roots. And so there's been a lot of arguments whether or not it actually, I'm sure a corn-soybean rotation will actually maybe help minimize, maybe a little bit, the actual inoculum that's out there. I don't know. But all I know is that I don't think a corn-soybean rotation slows it down much, in my opinion. We definitely have to go out there and tile and manage that soil compaction. That's huge with this disease. There was a lot of arguments and a lot of observations with tillage in 14. So a lot of times with no-till, we are going to have less compaction, maybe. And then some instances with some deep tillage, of course, you could eliminate some of that compaction. So with some of these diseases, with those survival structures, you have to be careful, and we'll talk a little bit about this with white mold. But you can vary those survival structures, but you can also bring them up again, too. So that's something to think about with these diseases. Next, we're going to talk about charcoal rot. We haven't had a huge issue, knock on wood, with this disease, mainly because it's environmental conditions. You're going to see this disease during a drought. But I didn't want to leave it out today. I still think it's very possible. I think that we have varieties out there. They may not be rated in your book from your seed provider. However, we do know some ratings agronomists do and breeders do on charcoal rot. So some varieties can be much more susceptible to charcoal rot than others. It, of course, is one of the major diseases out west and in other areas. We have to watch out for ratings, of course, in Missouri. As you move west, you're going to get droughtier conditions, and this disease can be a major issue in fields as the faucet turns off later in the season. One thing to note about this disease is, again, it does have a survival structure, and its little survival structures can be seen later in the season in the stem, and that's how we can identify this. The problem is that not only, a lot of these diseases will only infect soybeans. However, charcoal rot will also survive and can infect other plants. And so this is where the corn, soybean, or rotations don't help much, because this disease can also survive on other residues. So it's always out there. It infects throughout the season. Rarely it can infect early on as a root rot, but that's, of course, if conditions are conducive, and a lot of times we don't have droughty conditions early on, so we don't see it a lot early, and we see a lot later on in the season and at maturity. And so, again, it's very hard to diagnose this disease. It's going to be confused with a lot of other diseases, and it's going to be more visible and better to be diagnosed later on in the season. Just like a lot of these other diseases that we talked about, is when it infects and it gets in that stem, it interferes with the plant water uptake, and so that's whenever you start seeing yield loss. And it's definitely going to show up first in the heat of the day, in the stressed, dry areas. So certain soil types, droughty areas that you have in a field, that's where you're going to see this show up in patches first. And those plants die quick. I mean, it's like overnight, and the leaves stay attached. And so I remember getting some of these samples at the plant clinic, and it was definitely described as they died overnight, something happened. So the other thing I really want to point out on this slide, and this may look familiar, this is the diaporthe complex down here. So this is that phomopsis / stem canker. This is that. This is charcoal rot. So please don't confuse the two. Both of these symptoms, as you can see there, you don't see green stems. You see senesced stems. So this is going to be more able to be diagnosed, unfortunately, later on in the season. Now, if you're not sure, how are you going to figure it out? You may have to send it out to a plant clinic for it to be cultured. And this will definitely be able, you can grow this out on media, and you're going to get these structures show up, and you're going to be able to tell that it's charcoal rot very easily. And so that's one way that you can tell the difference early on if you're not sure. Again, I know I mentioned this, but with charcoal rot, you can talk with your agronomist or your consultant to try to find out which one of these varieties may be more resistant to charcoal rot if you've had an issue in the past. No-till definitely would be good. One thing you can do with a rotation is rotate with wheat. That helps. And the other thing, again, reduce populations. I know my dad's planting too thick sometimes. People really need to start reducing some of their soybean populations. It can be done now with seed treatments and our pre-emergence herbicides that we have out now with residual. And so just like corn, you get a too high of a population and the faucet turns off. That's definitely going to make conditions a little bit more droughty, and this can bring on this disease. So the next portion, of course, of the presentation is to spray or not to spray fungicide. We're going to start off by talking about white mold. It definitely, I'm starting to run out of time here a little bit. Do I need to start concluding the presentation, or do you want me to keep going on?
No, I would. We have about 5 minutes, so
okay.
Kind of, spend just a minute or so on white mold, and then a little bit on management, and wrap it up, and then we'll go from there. So we have about 5 minutes.
Okay, so white mold is not going to be as prevalent this year. Definitely going to be not as cool conditions. We can talk about that as another time, but I definitely want to take a minute and focus on some of the foliar soybean disease issues out there. They're definitely going to depend, again, on your variety susceptibility, your environment. Sometimes you're going to have more prevalent foliar disease with the later planted diseases in comparison to some of the earlier planted stuff. Earlier planted, you could actually get more foliage, and so you could actually have more issues. Later planted, you could have more possibility of getting more diseases because you have the right environment. And definitely economics play a huge role. So when we're looking to see what things respond to fungicide and which things don't, the two main ones that are going to respond to fungicides are your frog eye leaf spot and your septoria brown spot. The one thing that you want to make sure with diagnosis is that sometimes your frog eye can be confused with some of those contact herbicides. Your herbicides are going to grow out of the injury. The frog eye is going to attack the young succulent tissue more often. This disease, frog eye, is often confused with Philophthora leaf spot. So one of the differences is frog eye is going to have these little tufts. If you look at it with some magnification, Philophthora is going to have little dots in the lesions. So that's one way you can tell the difference. Philophthora fungicides do not help. The other one that's going to respond to a fungicide is your Cercospora leaf spot. It's these reddening on the leaves. It often is confused with sunburn, or even, this is a picture I got last week of Flexstar herbicide burn. If you can see with some of the burn, you can see where some of the leaves were covering it, you can actually see that you don't have symptoms, and that's how you tell the difference between disease and not disease. Some of the ones where fungicides are totally useless, of course, are your bacterial diseases and your downy mildew, because it is a oomycete like Pythium and Phytophthora. And so if you have these diseases, there are different ratings and differences in varieties, of course, if you have issues with these diseases, but fungicides are useless. We want to avoid all stress at R1, of course, because we're already getting flower abortion just naturally. So we don't want to do anything to hinder that. And so that's why a lot of times I think we definitely want to start spraying at that R3 or early pod stage. And that's where we get the most bang for our buck with our fungicides. And so what are we trying to protect with those fungicides? We're definitely trying to protect the yield. And so that's not only the number of pods or the number of beans per pod, but that can also be seed size. We get yield in those different ways, not just one or two of those. And so we are trying to protect any kind of stress, one being disease, during pod fill, which would be during the R4 and R6 growth stage. So timing is definitely critical. We don't want to spray too early because we want to protect against disease. But always read your fungicide label. And sometimes it depends, of course, on conditions, but you get about 20 days of residual control, depending on what fungicide you use. So there hasn't been a lot of research done on this, but some of the certain Iowa State and Ohio have come out thresholds. And so if we're looking at septorial leaf blight, that usually starts lower into the canopy. It's going to be a warm, wet disease and, of course, affect thicker canopies in different varieties. But if it's greater than 1/3 of the canopy, that's going to be a threshold for septoria. Some of the frog eye leaf spot, it doesn't take much for this disease. I just don't think we've had conducive conditions. It likes hot and wet. We haven't seen a lot of it in the last couple of years. So this is actually a study done by Iowa State. So why R3 application? So they did an actual study during 2008 through 2010 at 11 sites. And so here are some of the key elements of this research. They found that 60 to 7% of the time there was a break even with some of the strobe fungicides. And in essence, the more disease, the more increase on the rate of return or rate of investment. So they had double the response, the more disease. So they definitely, more disease, they increased their bushels to the acre. So there's been some talk, especially with corn and also with beans, whether or not fungicides improve water use efficiency. So this was definitely tested out in 2012. There was record high soybean prices, but there was also drought and no disease. And so what they found in this Purdue study was from 2009 to 2011 with these different treatments. What they found with the fungicide is that there basically wasn't a response, negative or sometimes negative. There was no response on the drought-stressed soybeans. So again, more bang for your buck, the more disease you have. I do think there's going to be more research as we go on. Fungicides definitely cause a retention of green leaf area and cause longer seed fill. And so there's going to be more work in this arena. But up until now, all the research points to more disease, more yield response. So this kind of concludes my presentation. I definitely want to note that there are different fungicide efficacies, and this is one good chart for that to tell the difference between fungicides. It's also important to note that, reminder, I know you probably already know this, but there has been resistance to frog eye documented. And so we definitely want to take note that some of the fungicides may be useless against the strobies, may be useless against some of the certain strains of frog eye leaf spot. If you are not sure what a disease is, you always can send it off to a plant clinic to help you. And lastly, I want to give a shout out to one of these new books that I helped. I was one of many to help review this book, and this is one of the newer books that's out that's pretty awesome to help you diagnose diseases. With that, I'll conclude my presentation, and sorry I went over a little bit. Are there any questions?
Well, for the sake of time, Stephanie, we're going to wrap this up, let people get on with things. I've got some questions here, Stephanie, I'm going to send to you. I'm just going to ask you to try to answer them, and we'll post it as a blog, if that's okay with you.
Yeah, that's fine.
I'll write those up and email them to you here shortly. And then you can post them as a blog this month here on the Also Advisor. You got to pardon my voice this morning. On behalf of the Illinois Soybean Association and Illinois Advisor website, and my siren just went off outside my window. I want to thank everyone for participating in today's webinar. I want to thank Stephanie Porter from Burris Seeds for the time she took to prepare and present this webinar. And again, as a CCA, if you registered, you will get a credit that will be applied to your account. And if you listen to the recording, you need to self-apply. Again, thank you very much for participating in this webinar this morning, and this webinar is now over. Thank you.